Everybody's ready, we'll go ahead and get started. Thank you very much for being here today, I really appreciate it. Just a quick little bit of housekeeping. Eventually you'll be hearing from every one of us back here, and also Administrator Buehrer. We're going to try really hard not to be duplicative in what we say, but no promises, but we'll do our best. We have a couple folks that are potentially joining us on the phone, so when we're done we'll take questions from everybody here, and if they remained online then we'll take questions from them if they have any at the end. Again, I'd like to thank you very much for being here as we introduce some legislation affecting the Bureau of Workers' Compensation. You know, 2011 we had a lot of great achievements as we transformed and started a new path forward. Under the leadership of our Administrator, Steve Buehrer, the Ohio Bureau of Workers' Compensation truly has transformed a new pathway forward. I'm comfortable with saying that 2011 was like no other year for the BWC. Likewise, I'm excited to say that these accomplishments have directly benefited employees, employers, and our taxpayers in Ohio. This General Assembly, we have participated in transforming how we view, manage, and fund health care in our Medicaid programs and with our private insurance, and now with the Bureau of Workers' Compensation. House Republicans have played a significant role in supporting the Bureau of Workers' Compensation achieving many of these important goals, including saving Ohio businesses and local governments more than $165 million per year. We have been able to achieve these incredible savings primarily by keeping focus on improving outcomes for injured workers. How have we succeeded? Average private employers pay base rates were reduced by 4%, saving Ohio businesses $65 million in premiums per year. Public employer rates were reduced by 5%, saving local governments and taxpayers $22 million per year. Overall, the Bureau of Workers' Compensation budget was reduced by 12% over the next biennium, saving the taxpayers $80 million. This was accomplished in House Bill 123. Many Bureau of Workers' Compensation programs were created, expanded to benefit the employees and employers throughout the state. The highlights of these reforms include a four-year, $4 million wellness grant program, which was created to reward employers up to $15,000 for establishing wellness programs to reduce obesity, chronic disease, and the effects of aging workforce. This, I know, has been successful that I've heard many employers talking about it, and I know that the Bureau has received a lot of applications and are looking forward to the success of this program. Destination Excellence is a new rating plan that will reward employers that establish risk management plans focused on improving safety, prevention, and return to work rates. Expanding the Safety Council rebate program. It allows group rating employers to qualify for 2% premium discount for demonstrating improvements to employee safety. The first ever BWC formulary for medications was established to improve the efficiency of treatment, lower the Bureau's prescription drug costs, and is estimated to save the Bureau of Workers' Compensation around $15 million in its first 18 months alone. The Grow Ohio program was established to provide significant premium discounts for employers. Employers can opt for a 25% premium discount for 2 years, or they can immediately join group rating, saving up to 53%. A one-time forgiveness program was introduced this year as part of a common sense initiative, which waives penalties and interest for missing a premium payment for the first time. But now this new legislation, the dawn of some new transformation. The Bureau of Workers' Compensation and the House Republicans are committed to continuing improving the outcomes for injured workers, knowing that this focus also helps businesses and the Bureau of Workers' Compensation. Although we've made great strides within the Bureau alone, it is clear that we need legislation to make even a bigger impact. We've introduced 3 bills that are marking what we're calling the beginning of transformation in Ohio. As part of this era, we have asked the Bureau of Workers' Compensation to do more for injured workers and do more for businesses. Most importantly, in this era, we will come to expect the same health care quality in the Bureau of Workers' Compensation that we expect in our private insurance plans, that we expect in our state and federal health care programs. With the passage of these bills, there will be no question that the Ohio Bureau of Workers' Compensation works for the greatest producers in the state, our employees. We have three bills. The first bill that will be discussed will be House Bill 516. Representatives Henne and Representative Hottinger will manage this bill, and it streamlines the Bureau's administrative processes. House Bill 517, myself and Representative Newbold will manage, and it is tagged Superior Health Care for Injured Workers within the Bureau of Workers' Compensation. House Bill 518, Representative Landis and I will manage, and that bill we have coined faster outcomes for injured workers within BWC. To conclude my opening comments and portion regarding the transformation and the focus, we believe that by focusing on helping injured workers return to work through measuring outcomes, not just visits, we can create a much better functioning Bureau of Workers' Compensation that primarily improves the lives of workers while working for business owners and employers. The success of this legislation has two major implications: always focusing on improving the lives of injured workers and their ability to get back to work. We have focused on meeting these goals. We know that injured workers will be better served and the cost of doing business can be lower. Therefore, we are focused at the BWC transformation, or we are focusing on the BWC transformation because we believe that it improves lives of the workers and creates jobs at the same time. As we look at this, it will be truly a win-win for Ohio. At this point, what I'd like to do is introduce Representative Henne, who will provide us an overview of the first piece of legislation. Representative?
Thank you very much. What's exciting about these bills is it's a win-win. By concentrating on the worker and incentivizing the employer to provide a safe working environment and getting the worker, make sure they get quality care to get back to work quicker, it's a win for both the business and the employee. My business is insurance, and there's some truth about insurance. One is there's nothing better than just preventing the loss. You can never really be indemnified 100% because there's intangibles with insurance. So by avoiding the loss, and we incentivize employers to provide a safe working environment, we're helping prevent. And then there's nothing better to minimize the loss for a business than getting the business back running the way it was before. So providing the quality care, getting the worker back to work quicker is a win-win for everybody. 516 is a bill that takes a variety of changes to BWC which benefit injured workers and employers statewide. These changes will help modernize the workers' compensation system, provide options for employers, and encourage return to work for the injured worker. The legislation represents the House's continued commitment to improving outcomes for injured workers and does the following. It permits state university hospitals to participate in the self-insurance. Currently, the law only allows the state universities, not the university hospitals. Oversight would be corrected in this legislation. It would permit political subdivision to participate in the one-claim program. Currently, only private employers may participate in this program. Legislation expands the one-claim program to include cities, schools, and other public taxing districts, providing them with an important tool for lowering their worker compensation costs in the event of a significant unexpected claim. Provides relief to employers by modifying the assessment for older claims, DWRF1. There are currently enough reserves to pay claims and obligations with the Dwarf 2 assessment, and the need for the Dwarf 1 assessment has declined over time. It allows the Bureau to publish its rules electronically rather than in paper form. This will help reduce the cost. It will standardize the process of objecting to assessments. The legislation removes the requirement that such objections be filed via certified mail. These are the only filings required to be sent certified mail, so by removing it will help streamline the process. And it will encourage the Bureau in its effort to build incentives for employees to be actively engaged in the workplace safety and wellness program. So, next, who's coming?